All right. Well, we are back with the one and only Dr. Grant Chyz, and I'm excited to introduce our second part two of our webinar with Dr. Chyz. The last one was fantastic, and I can't wait to learn more. These are going to be more advanced, I guess, subject matters and more interesting for some, hopefully. So, Doctor, who you are, quick background, and what we are going to learn on this upcoming webinar.
I live and practice in Seattle. I'm doing some I'm affiliate faculty at UW, working with Ali Rezda Sadir, and so I've been in practice for 38 years. I have I'm an independent practice, so I do see people with insurance, but I'm not an insurance-based practice, and that plays into my perspective on care. At this seminar, this webinar, we will be getting a little bit nerdy about structure and crack. So we'll look a little bit at some key studies with relevant examples, why this matters for what we're doing, because it affects the judgment as to when should we be proactive? How should we address structural issues in teeth? We need to have those ideas be based upon research and science. And then I'm going to show some examples of more advanced fiber management for direct restorations, larger fillings, for example, and a very innovative core buildup technique, including a deep margin elevation case with actually a crown, because it started with a crown.
Very cool.
Deep margin elevation with an innovative fiber core that has, if anyone's seen it, it's only because they've seen Ali or I talk a little bit about it. It's a research article that's in final stages leading to publication.
So this is new stuff, basically.
We mentioned the research a couple of years ago, but getting it to the point of, takes a while sometimes to go through all the steps. So this is something that I've used in practice, especially since validating with the research.
You have to give us a little teaser on there. Like, what is it? What?
So this is everything we know about dentistry. Any dentist who's practiced knows the Farrell effect. We know that if there's enough Farrell effect, we can be successful.
Right.
So we'll be carrying that forward to say things that Pascal, Dr. Mann has spoken about, that posts don't help, number one, and peripheral tooth structure matters. That's behind the concepts of BioRim that Graham Milicic talks so much about, and others, having sound peripheral tooth structure. And so when we're doing a core, when we have nothing, virtually nothing, and we're doing a core, it's not what we put on the floor of the pulp chamber. It's not any posts. I don't do posts. What we're doing with this concept is building peripheral support by moving the fiber support out to the edges of the prep. And so it's a peripheral fiber reinforced core.
Well, that's it. That's pretty cool. If that sounds interesting, you have to show up to this webinar. Who else, if we're kind of talking to biomedic dentists or people who are interested in biomimetic tooth conserving dentistry, who else would you want to maybe invite to this webinar?
Well, I mean, I would invite any practicing dentist, but particularly dentists who, when they're working on a tooth, really wish they could preserve. Dentists who don't feel good about just prepping a tooth down for a crown. Like, is there another way to do good dentistry? Is there a way to make it last longer? Dentists who see cases they do go to endo quite readily, where they don't like the fact that this is happening. They recognize that it's trauma that partly we're causing. So how do we not do that? How do we manage teeth that are symptomatic or become symptomatic after we treat them? We take out an old filling, we do a new filling, and it hurts. Why does that happen? That's cracks. And we'll talk about how to manage that from the very beginning. It has to be the first thing on your mind. It's the first thing on my mind when I start working on a tooth, is structural integrity of the tooth. So that is the fundamental basis, is managing the structure of the tooth. The second part is managing the restoration so as to preserve that tooth.
Right.
And make the bond interface last. And so those are the fundamental pieces that we'll be talking about.
Well, sounds like you've got some real secret sauce here, and thank you for making it available to all of us who show up at the webinar. We do invite everyone to show up. Dr. Grant Chyz, thank you once again for jumping on this quick little teaser video with us that we like to use to promote our upcoming webinars. And if anyone has any questions, feel free to reach out and please join us.
Looking forward to it.